Welcome. In this short video, we are going to understand the best practices relating to documentation. Remember, it is not done if it was not documented. Biodata on charts should be complete. All fields have to be filled in any performa or a page in the chart. A revised diagnosis or the most updated diagnosis is to be added to the first page of the chart and in the subsequent progress notes and on interdepartmental calls on discharge slip or on death certificate. PGRs have to add progress notes in all shifts. Procedure notes have to be added as we will see later. Resuscitation notes, expiry notes are to be added. Counseling of parents, especially father if available, is to be documented. Otherwise, mother or any other relative taking care of the baby is to be counseled. Remember, it should be written counseling. Consent for procedures is to be documented. Vitals monitoring sheet should mention name of the baby, registration number, date, time, and then the vitals values. Medication chart should not have any overwriting or cutting. It should be filled in a legible way. Doses should be correct. If a drug is to be given as an infusion, then it should be mentioned to give as infusion. For example, injection vancomycin 30 mg as infusion in 15 cc normal saline, IV slowly over 30 minutes into 8 hourly. If you changed the fluid type, fluid volume, drug dose, etc., then write new drug orders. Do not cut and overwrite previous drug orders. If a drug requires cardiac monitoring, then mention along under cardiac monitoring. For blood transfusion, mention on medication chart as after blood group and cross match, transfuse 20 ml of PEG cell volume, IV slowly over 3 hours. In case of transfusion reaction, stop the transfusion immediately, activate emergency protocol and send back to blood bank for recross match if required. This is just an example. With all drug orders, must write date and time and signs along. If you hold a drug, again write date, time and sign it. For example, if you have discontinued a drug, then there should be the date and time along with that discontinuation note and your signatures. Add transfusion notes for blood products in the chart. So mention as date and time of transfusion, blood group of the baby, blood group of the donor, transfusion volume, post-transfusion vital signs, any adverse effects noted, and finally your name and your signs and stamp. Remember that signs are not an alternative for name. You have to write your full name, then come signature, and then come the stamp. The slips for ultrasound scan, echocardiography, X-ray, blood tests or any other tests should have following details. Name of patient, registration number, date, the most updated diagnosis, mention that the baby is admitted in NNU, region of X-ray or ultrasound scan, your name, your signatures and the stamp. You must write your name under progress notes, resuscitation notes, on discharge slip, lab request slip, counseling notes, consent for procedures, etc. Signs will not suffice. Mentioning name, signs and stamp is required. The format for documentation of consent or counseling, the heading should be as consent for, let's say, lumbar puncture or counseling, date, time and the statement in Urdu. रीढ़ की हड्डी से पानी निकालने का इजाज़तनामा, and then the statement, then your name, your signs and stamp, then comes attendant name, relation with baby and their sign or thumb impression. See here that for counseling or for taking a consent, you are not only getting the signatures of the attendant, you are also mentioning your name, signed and stamp, and you are also mentioning the date and time. Format for resuscitation notes is as follows. You will mention date, time, explain the events and what issues were identified, explain the intervention done to address the issues, mentioning time along, mention drugs with doses that were given and after how much interval, be elaborate to mention if you cleared airway, did ECG, checked BSR and its value, etc. Add counseling notes separately as you inform attendants. Mention drugs given as stat doses on medication chart also, and staff on duty will sign against the orders there. Next, write your further plan and then your name, signs and stamp. See here that if you're adding resuscitation notes and you gave fluid bolus or injection adrenaline and you repeated adrenaline again, then just mentioning here in the resuscitation notes will not suffice. You have to write these as stat orders in the medication chart also. Format for death notes. Mention date and time of adding notes. Explain what issues were identified terminally, what steps were taken, and which drugs were given to the baby. The drugs must be mentioned on medication chart also and be countersigned by staff nurse who gave these. What monitoring was ongoing, mention all events and medication management done, keeping account of timeline. You may add the resuscitation details here or separately in the resuscitation notes. Finally, mention the time of death and the final diagnosis. Final diagnosis must include details such as pulmonary hemorrhage, etc. And then write your name, signs and stamp. A copy of death certificate or discharge slip is to be made part of patient chart. Attendants are not allowed to take photograph of patient chart. All discharge slips are to be countersigned and checked by senior registrar of the neonatal unit. If a consent for performing a procedure is not given, write a small refusal statement and get signatures of attendants as follows: date, time, refusal for, statement in Urdu, name, sign and stamp of doctor, then comes the name of attendant, relation with baby and signs or thumb impression. The format for procedure notes is as: take consent first as per format discussed earlier. Take and document the pre-procedural vital signs. Write procedure notes in detail, then mention all steps you did and success or failure or complications in procedure. Then post-procedure vital signs and if any monitoring is started further, then if a sample was drawn, where it is sent for tests, analysis, etc. Doctor's name, sign, stamp, date and time. Reiteration here. Any notes, counseling, etc. must be accompanied with the name, signs and stamp of the doctor and the date and time. If signs of attendants are taken, then write their full name and relation with the patient also. Investigations. A common place side-by-side sheets should be allocated for mentioning results of laboratory tests. If you send CBC, CRP, blood culture, then mention there in empty space around lab results that these are sent on date and time. If you have repeated CRP today, then write there CRP repeated, date and time. This will ensure continuity of care in your absence and will also avoid unnecessary repeat venous pricks. So, if we are using investigation proforma in the chart, there you can mention which labs have been sent, on what date and time. You may also sign there, and if you have repeated any labs, then simply putting a note there will create ease for those who are preparing for round next day or evaluating the chart. Thank you.